Now I'm going to show you how to cast with a 2 1/4 inch casting box without the rotator, but please watch the Rotator movie because you'll pick up some things from that. If you don't have our rotator, you take anybody's box. Set the patient down approximately 90 degrees to the chair. Can you please move forward a little bit? That's good. If it's a tall person, put a phone book under his butt. If it's a short person or a child, put one box on top of somebody. So according to the instructions on our site, you open up the box, pick up the foot, and again, you'll be level with the floor. I'm using this table just to make the movie easier to show you some things. And then you'll see us cast the patient out front and take a movie and see how it's done from the floor. So right now the whole idea is the center, the knee, 90 degrees to the ankle, which would be the same as the foot doctor. This is one way. Can pick up the foot, hold it in midair, put the plaster on, and then he moves the heel in and he moves the heel out. He everts it and inverts it, and when he finds subtalar neutral by feeling the navicular talus joint, he'll then lock the foot at 90 degrees to the leg. And Mr. Foot here had lipstick on because we used it before in the Rotator movie, so I'm going to wipe it off. Or maybe I'll just leave it on. We'll just start from scratch. If you forget, you can put it on afterwards and push the foot in, but I'll put it on now. This is to show me that there's a callus on the foot, a wart, a bony prominence. So you set the foot down in the center of the foam. Keep the heel 90 degrees to the leg. And the whole idea is to pivot on the center of that heel. That's what our rotating machine does. But we're going to switch hands from the rotator. I'm taking my left index finger on his left navicular talus joint. And if I was to turn this box counterclockwise, you basically see he's pronating. And the tibia is coming inward. And as I turn it clockwise, you see it going away, and I'm supinating him right now. But I'm pivoting on the heel. And you want to use a non-slippery surface. A carpet is much better than a slippery floor because I use the rotator here all the time if I'm seeing a private patient. So I'm going to go back and forth. Real easy. Feel exactly where neutral is. And at this point, I want to plug this light in. Can you see this shot right now? If you set the foot in neutral, the heel in the back should come up a little bit more, right about there. And now his heel is even with the Achilles tendon. You can see he has a nice high arch, and here he has his approximately 4 to 6 degrees of 4-foot varus off the top. Again, if I pushed all this down, that would be a perfect foot with all the heads touching the foam and the heel touching the foam. But here, this is the deformity. So when it comes to any lab, we want to see how much this is off the floor, and that's where we would add all the corrections, as you saw in the YouTube, the making of the orthotic. So at this point, the first head, the second head, and the third head. Can you see that good in the camera, Mr. Cameraman? Okay. So I'm going to hold the instep. You only have to push with 25% to 30% on the knee. You're using your 2 fingers on the instep to push the foot straight down with 70% of the pressure. Again, you're going to be up about this high because you'll be on a level floor in your office. This is my regular casting table, which is easier for my bad back, and I used to have people sit up here when I'd cast their leg to make shoes. So at this point, you also are going to use these 2 fingers to keep the heel going straight down, because you can push the whole foot to the left or to the right as I'm doing now, and sometimes the casts come in. the lateral side was pushed underneath the foam to the left side of the piece of foam. So at this point, I'm steering it straight down and pushing the heel all the way to the bottom. I'm going to place the palm of my hand over the heads. I'm incorporating the fifth head. If you have a big, large foot and your hand is small, you must keep your hand on the fifth, and if it doesn't get all the way over, that's fine. But the fifth is the most important. Keeping this angle that the foot is in, I'm going to push it straight down. And if you're new at this, don't worry about your fingers. If your fingers are on the side, until you do 3 or 4, you'll learn to get your fingers up in the air. Then cast it with your fingers showing. We know it's your fingers, and we'll shave it off when it gets to the lab. So I'm going to push completely even, straight down, 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 until I feel the fifth hit the bottom of the box. I do not want to roll my hand and push the first, second, and third down. I want it to stay exactly how it was when we casted it. Then I'm going to push the toes down. Come back over to cuboid. And when you have a long foot and you push the heel down and you push the forefoot down, sometimes the cuboid stays up in the air. So I'm coming over here with my thumb on the cuboid, and I'm going to just give it a little oomph. Now here we go. If you have a size 11, 12 foot, sometimes you create a little bit too high of an arch here. So when I push down here, when I'm done, it's just to seat it. It's not to push it to the bottom of the box, but if it's slightly up, you just delicately give it a little push just to make sure it went down to where it belongs. At this point, I lift up the foot, take a baby wipe, take off the lipstick. Put the foot down, close the lid, turn the box around, and we're going to do the same for the right foot. And also, besides marking off calluses, and this foot was used before to demonstrate on the rotator, some people have a medium to high arch, and if you dorsiflex the big toe, you can see the tendon popping out here. And if you want to show me that tendon popping out, put some lipstick on there, because this is one of the causes it helps heel pain. A lot of patients have heel pain, and it's this tendon that's going through the sesamoid bones, and therefore if we see it in the cast, we'll put a groove in the orthotic plate and gently just place, center it. Do the same thing as before. This time my thumb is in the navicular talus joint. I'm going to center the foot 90 degrees to the knee. The foot is 90 degrees to the leg. And if I turn it this way, I'm going to pronate. If I turn it this way, I'm going to supinate. Okay, this is just the reverse as before, but the pen is sliding underneath the foot. And the first metatarsal, second metatarsal is up about 4 to 6 degrees, a 4-foot varus, which I'll show you later. And again, at this point, I'm going to push the heel all the way down to the bottom of the box. Place the palm of my hand on the same angle that you see here. And push it all the way down till the fifth hits the bottom, without rolling across and pushing the first down. Come back and push the cuboid. Lift this up. Wipe off the lipstick. Now, I want to go over the first problem in casting. Since we did this left foot, here's the problem I have. Doctors are doing this foot, and after going to college for at least 6 to 8 years, won't even look at what they're doing. So if you will look at the cast when you do this foot and take it out, the first thing you should have done with the left foot is grab a pen out of your pocket. Most people have a pen. Put your finger on the top, and you notice how deep it is. I'm using my finger as a marker. It should be the same distance here by the 5th metatarsal. If you did it correctly and there was a varus deformity, you could see my fingers above the foam. Check it now, because I get casts in that are completely terrible, which I'm going to show you in a minute, and it means you didn't even look at the first one, because if they come in a pair of them, both of them deformed the same way, both of them taken terrible, that means the doctor didn't even bother to look. The personnel in the office didn't look when they mailed it out, and when it comes to the lab, I got the terrible job of calling up the doctor and saying, "You gave me a bad cast, I want it redone, because I will not make it." And I hear excuses, "Well, I didn't realize it." Well, you didn't stop to look. Everybody has a cell phone today. Grab a cell phone out of your pocket. Use your cell phone to measure. I'd like to tell you to use a ruler, but most people don't walk around with a ruler. So grab your cell phone, get an idea that the heel's all the way down to the bottom, mark it with your thumb, come over here and see that you pushed it down. Because this is what I get in. This is what a cast would look like if you didn't push the front in. The heel was pushed down, and you can see if I hold it level that it's thinner in the front. Why? Because the doctor sent me this in. These are just samples I did. But I'll get a left and right that looks like this. That means the heel is all the way to the bottom of the box, and he never pushed the front of the foot down. That means your patient was walking in like this. And I haven't seen anybody walk in my door like this except somebody who was in a car accident and had pins in his foot, and lucky to save the foot. But 99% of the people walking around are walking around with their foot on the ground, unless they're walking uphill. And this is what a foot doctor will send in sometimes. Probably because he was teaching somebody and never looked to see how they sent the cast in. Or a chiropractor trying to do it right, but he doesn't take the time to look on the left one, and he'll do the right one. Here's another one that came in where they didn't even push the heel in but 1 inch. I'll turn it around. Now, as you can see, they just pushed the heel in first, then they tried to push the front in, and leaving the arch way up in midair. Now, unless the person was really like that, I haven't seen a whole lot of really high arches and someone walking around with their heel like this where a mouse can run underneath the arch. Now I'm going to show you what the cast looks like. I'm just going to cut this one in half and again show you. Here's the heel at the bottom of the box. Here's the toes up here. How can I make anything from that? It's completely missing the whole shape of the foot. 2. Here's the one we just showed you again. I'll just cut down the middle. As you can see, they didn't even get the heel to the bottom of the box. They got the front lower than the heel and this part high. And now here, here's the foot we just did, and you try to cut right across the 5th metatarsal. It's cracking as I'm cutting it, but I'm doing my best. And I'm going to show you what it looks like. So as you can see, here's the 4-foot varus right here. You got to look down where the first metatarsal is deeper, but it rolls up on the side. So here it is higher, and it's lower. It's lower on the lateral side. And this is an average good cast.